And so we're just going to go through and do quick introductions of everybody on the line today. Your name, your role on the commission, or how you support it. I think that'd be great. So I'll just kick us off. I'm Casey Dreer. I'm the chair of the commission, and I'm a juvenile attorney here in Lane County. Jesse, you want to go?
Yeah. I'm Jesse Powell, commissioner here, lived experience, and my day job is I work for Morrison Child Family Services as a parent mentor, specializing in reunification. And I will pass it to Sarah King.
Hi, my name is Sarah King, she, her. I am helping fill some of the roles that Ellen did until this position is able to be hired for. So I'm with ODHS. Donna, do you want to go?
Sure. I'm Donna Haining, she, her, and I'm the assistant manager in our foster care program. Happy to be here. Billy?
Hi, Billy Cordero. Actually lived experience in foster care and have been with ODHS for 28 years. And my primary role right now is retention and recruitment of resource families program in our central office foster care program. So glad to be here, and I'll be supporting whichever role Donna has occupied going forward. I think we'll tag team for a little while, but it's good to be able to join and meet and get to know you all. And I'll go to Adam.
Hey folks, Adam Rodakowski. You see him pronounced. In my work, I'm the director of foster care at Greater Oregon Behavioral Health. I'm just an interested member of the public for this meeting, so that's why I'm hanging out camera off most of the time, but just like to keep myself up to speed. So, Michelle.
Hi there, I'm Michelle Pfeiffer. I'm the legislative coordinator for child welfare and for OTIS, and I was invited today to present on our legislative concepts for this upcoming and long session. Alicia or Alicia? Sorry.
Sure.
Alicia. Hello. Sorry I was a few minutes late. My name's Alicia Richard. I'm a person with lived experience, and I work for the Morrison Parent Mentor Program, who they all work with moms and dads that are involved with child welfare. Was there anything else I was supposed to share? Okay,
No,
good.
we're just doing quick updates today, or
Okay.
quick
Yep. And
intros.
I do have to leave a little early today for another meeting, so just letting, if we have quorum, just letting you know, Casey. Let's see who hasn't gone. Jesse, have you gone?
Yeah,
Yes.
I think you were the last one.
Okay.
Billy Cordero.
No.
Billy
Billy,
Cordero. Yes,
Billy went.
Oh, Billy went. I'm sorry. Yes, Billy
Yeah.
went. Okay,
We
that
have
does look
Sarah
like everybody.
Powers. I don't know.
Sarah.
Oh, we do. Sarah, do you want to give a quick introduction?
Sure. Yeah. Hi, I'm Sarah Powers, she, her. I'm a pediatrician with Clackamas County Health Department. Applicant to the commission, just still waiting to hear about that. So, but I thought I'd hop on and I can stay till 12:30. I do have to leave at that point, so I hope that's okay. But
Perfect. So, just to catch everybody up I know Alicia jumped on a little bit late. We do not have quorum today. There's only 3 commissioners present today, but we do have a packed agenda. We've got lots of updates today, so we're going to jump right into it. Just Sarah, for your update, we are pushing to get the nominations through and the confirmations done. I know that there was some dates set in April that we were hoping to get everybody set on. If we weren't able to get them, the names moved for April. The next opportunity is June, and we would anticipate all of our current nominations being nominated by then or being confirmed by then. So I'm going to hand it over to Michelle Pfeiffer, who's going to talk about the legislative concepts. Appreciate you coming so early to loop us in for next year.
Absolutely. So, child welfare has 3 legislative concepts for this upcoming session. 2 are kind of technically placeholders right now because we're still gathering more information, but I'll start with the one that is very baked, which is aligning our child abuse definitions to add labor trafficking as a child abuse definition. That is currently part of our federal CAPTA laws is having labor trafficking as a child abuse definition. So it is simply getting in line with the federal government on that. We don't anticipate that that will create a significant workload. Like, thankfully, there is not a lot of reports of labor trafficking here in Oregon for our kids, which is great. So it'll be, as I understand it, a no fiscal legislative concept, just to add that definition to the 419B definitions. And I will take pause for questions kind of after each one. So, any questions about that one?
Yeah,
Michelle,
this
I
is,
don't have
Oh,
one second. I don't have a question, but I forgot to ask if anybody would be willing to take notes today. I'm on my phone outside of the courthouse, so I'm having an inability to do it. And I know we have some people leaving early. Would anybody be available, or anybody from the ODHS staff be willing to help us today?
Sorry, couldn't unmute. I'm happy to. It's also recorded, so but yeah, I'm happy to take some
Thank you
notes.
so much, Donna. There shouldn't be any action items today, so it should be very quick. But
yeah,
did I
so
hear somebody have a question?
yeah, so this is Jesse
Oh, hi,
Powell.
Jesse.
So my question is around the labor definition. Does that also absorb any sex trafficked individuals?
Yeah, so we already have a definition for sex trafficking in
Okay.
our statute and sexual exploitation. So the involuntary servitude or labor trafficking is it's a pretty narrow addition.
Okay.
And again, I think what our hotline team has looked at, that this won't be a big increase in our assigned reports. So, um, but it is the federal government passed a law that labor trafficking is child abuse, and states were to pass their own laws to comply with that, and we just haven't quite gotten there. We had it in a previous bill in 2025, but there were many other things in that bill, and it did not pass. And so we are pulling it out independently to pass as a non-controversial legislative concept. Any other questions about that one? Okay. So the second legislative concept that Child Welfare has is around the privacy for Native children. So we've heard through our ICWA advisory meetings that our Oregon tribes would really like us to look at a legislative concept for out-of-state placements. If you remember, there was a bill passed this last short session to allow for out-of-state placements that align with tribal preference under ICWA and or ICWA. And right now there is a statute that for any time a child is placed out of state through child welfare, we have to publicly post on a website key demographic and like information about the child, and then also information about the program in which the child is placed. And one of those required statutory data reports is around tribal status. And what we've heard from our Oregon tribes is they find that that would be potentially identifying to their youth, and they would like the tribal status to be removed from that reporting requirement for ODHS. So that is something we're having a meeting in the beginning of May with tribes on to make sure we understand what their specific ask is, make sure what we put forward in a legislative concept aligns with what their request is for ODHS to do. And then we're also going to be talking with them around our CIRT, so our critical incident review teams, which is primarily when there has been a fatality of a child that meets certain criteria that has had specific interaction or DHS awareness of that family within a certain time period prior to that child's death. And tribes have asked for their tribal status and the information about that their children that are in members of their tribes to have increased privacy. So I think we're still trying to understand what the scope of that looks like. Do they just not want us to have specific tribal status listed in the final reports? Don't know if any of you have seen our final CERT reports, but they're incredibly detailed about families, their history, closed out screenings, previous interventions with that family. And there has been a relatively recent CERT report that did involve one of our tribes, and they found that information that was shared to be very identifying to that family. And we're pretty concerned about it. And so we'll be exploring again in that early May conversation about what exactly would they like us to do? Is it just limiting so that you would not be able to identify that the child was a member of a tribe, or is it some kind of increased privacy that they're asking? But I kind of have that as a Native Children Privacy LC to explore with tribes. Any questions about that one?
Yeah, sorry, Michelle. I mix up 11:30 and 12 p.m. again.
Oh, it's all right.
Yeah, so would you mind just like going just like saying what specifically you're talking about? I got the gist of it. I just need to, know the specific topic. Sorry.
Yeah, so we were talking about our legislative concepts for the 27 session. And the one I was just talking about is one that really is trying for us to be responsive to the requests that we've heard from tribes at our ICWA advisory committees, where they have asked for child welfare to put forward some different a legislative concept to make some changes to the statute that align with their request for additional privacy for their members. Is that
Gotcha.
helpful?
Thank you.
Yeah.
Yeah. I heard tribes and other stuff, so
Yeah.
sure it's something to do with that. Thank you.
Any other questions on that one? Okay. And then the last one has kind of it has a tribal component, but a little bit different, but it's still around our CERTs, or our critical incident review teams that are required by statute when there has been a child fatality. And right now, the membership is listed in statute about who is required to participate in a CERT and those who are optional. And we have heard from tribes that they would like to be a required participant when the child was a member of their tribe. So we are moving forward with putting that forward. The other one is a suggestion that came up internally on participation, which right now our communications director within ODHS is a required participant for all CERTs. And there's been a request for that to be not a required participant, but an optional participant. We've heard from some folks that because they're a required participant, it can add to a perception that CERTs are not a neutral or unbiased report, and like maybe the comms person is trying to manage, PR or manage some of those public optics. And that's not what their role is now. But to kind of address that, it's really to say we don't need our communications person at every CERT. But if there is a high profile or like high media involved case, maybe they would be a optional participant on those cases. But those are just specific to the participant list. So that legislative concept is pretty narrow to that. Any questions on that concept?
I have a question a little bit off topic, but as we're on ICWA, I was just trying to look it up real quick, but being on my phone, do we recognize, are people eligible for ICWA if it's not a nationally recognized tribe? For instance, Chinook is a very big tribe here in Oregon, but they're not nationally recognized. Do we know if those children qualify for ICWA or if it has to be a nationally recognized tribe?
I do believe it has to be a federally recognized tribe. I am looking at Donna, Billy, and Sarah to help me out if you are more knowledgeable than me. But I believe the federal government can only really, like when ICWA was passed, it is really about those federally recognized tribes.
You're correct. Which doesn't mean that we can't do what we should do for the family, for sure. But
Or engagement with the tribe, all of that. It just has different legal expectations, I think. That's a good question, Casey. And I think how we would probably have that LC written wouldn't be narrowed to only ICWA specifically, but it would be like the privacy one would be about Native children in general, and then the in terms of like a tribal participant for a cert, I think we would just have as a Native child. But I think that's something we can explore with our legal folks to see how we can write that in an inclusive way. Any other questions? Those are our three legislative concepts for child welfare. We do have one that I would like to update this group on. So I think you all may have heard about there's the Office of the Children's Advocate. It was set up in statute in what I can see as probably the 80s, like $1 or something like that from every filed birth record goes to this office, and it has very specific statutory requirements on child abuse reporting, prevention efforts. What I can see from the history is that I think it was around 1993 that work came to ODHS under a memorandum of understanding. And as far as I can tell, like DHS has not really fulfilled the statutory duties in their entirety for that office and that work. So with the governor's advocate, it's currently like under the governor's advocacy office. And that statute hasn't been updated since I think 1993. And there's some old, outdated language in there. And so I do have a placeholder for us to consider what updates to that statute could look like for that to actually be fulfilled by ODHS. Right now, the children's advocate requires an appointment by the governor and by the ODHS director. And we don't have anyone currently appointed in that position. And when I talk with the governor's office, they haven't seen anybody appointed in that position for kind of like as long as their records go back. And so this has kind of been a unfulfilled body of work for a while. I think there are some parts of child welfare that have been fulfilling some of those duties outside of that office, but we're really looking at how can we live into that statutory mandate and fulfill that work in its entirety. So more to come on that. It's not a child welfare legislative concept. I'm helping the governor's advocacy office with that one, and so it may be worth having them come present when they settle on some of the proposed language. But right now it's just a placeholder, which means it's kind of, we've just given it a title and said there's something here we want to look at and look at some changes, but we haven't specified exactly what it is. But there is definitely outdated language from the 90s, if you can imagine, in there. That's at least a starting point. Yes, Jesse.
When you're stating LC, is that like abbreviations for like language content?
Oh, it's a legislative concept. So
Okay.
it's just like the very first idea of what a bill might be for
Okay.
27. Yeah. And just a little bit of an update for how this all works. So right now we are saying, here are our ideas. They still have a vetting process, an approval process that goes through internally within ODHS for which ones move forward to the governor's office, and the governor's office takes a look at our legislative concepts, and if they get all thumbs up, then they actually get drafted as potential bills. And the drafting happens over the summer. So we have, for some of these placeholders, we have until early mid-June to settle on what language we would like to see in the bill for it to be posted in, I think, January or February, right before session starts. So I would say like overall, this is a pretty light legislative concept load for child welfare going into the 27 session. In the past sessions, we have taken on some pretty big conversations, at least while I've been here in 2023 and then in 2025. I think things are a little bit different this session. There's a lot of conversations going around about child welfare reform, but they're not going to be led by child welfare. I wanted to make sure this group is aware that Senator Gelser Bluen and the Senate Committee on Human Services is leading a couple different work groups. One is on Otis investigations, which are investigations in schools and daycares of child caring agencies, IDD, group homes or foster homes, and then third party, which is like professionals in the community, and then non-professionals like internet crimes and strangers. And so there is a work group going on. There is public posting of that information on the Senate Human Services website. There's like a little link that says work group. You can watch them. They're recorded meetings. And there's also some meeting materials in there. I anticipate there will likely be legislative concepts that come out of that work group. And so would just suggest if maybe somebody from this group attend and report back if you don't already have that planned. And then there is a second work group on, it's called Beds to Belonging. It's around temporary lodging. And that is also being led by the same kind of people, but a separate work group. So I don't know if I just want to make sure you guys knew about that because I do think legislative concepts will be coming. So if you want to stay informed on what the conversation is leading up to session, I highly recommend attendance at that. I think I
Michelle,
saw you nod, Casey, so maybe you heard about them.
yeah, so I did get the invites to both of them.
Oh, good.
They didn't give me any heads up on them, so I got the invites like 12 hours before the first one began at like 9:30 in the morning. The times that they set, I can't attend. I'm in court, like on a docket those times. So if there's somebody else from the commission that is interested in attending, let me know. They set, I feel like there was like 50 hearings set over the next couple of months. So, you know, there's a lot of opportunity for engagement there if you're wanting to do that.
After I talk here, I'll drop the link in for both of the meetings. So if anybody does want to track them, they can do that. They are, Casey, so they're scheduled twice a month on Wednesday. So it's every other week until the start of session. So it is an incredible amount of time leading up to session. But it's every Wednesday, and the work groups are one's in the morning. So the Otis investigations in the morning for 2 hours, and then temporary lodging or beds to belonging is in the afternoon for 2 hours. So it is a lot of time. But again, if you aren't able to attend, maybe watching afterwards or reading the note summary of kind of what the conversations were might be helpful for this group as you stay up to speed on some of these issues. I think particularly for you all around the beds to belonging or temporary lodging is probably a key conversation for you all to be up to speed on. And then I also have a recommendation for asking for child welfare leadership maybe to come and present on kind of what is the post-settlement, because the settlement agreement ends in December. And so having a presentation on kind of what does post-settlement world look like for temporary lodging and temporary lodging prevention. I think there's a lot that's going to be happening this summer to prepare for that. Dean, I'm sorry that I just saw your hand.
Yeah, no problem. So, first, I want to thank ODHS and Child Welfare, of course, for working on these issues. And the second thing is, so there are a few things, one of them is more of a question. Well, actually, they include like a couple questions, but there are just a few low-hanging fruit that I wanted to ask about that I think that Child Welfare could either implement as policy or or through legislation. The first one is I'm a little bit curious if, for example, say that like children are Jewish, for example, or Muslim, and they have to be placed in a foster home. How does the state or does the state even keep track of if they are like following the child's requested kosher or halal guidelines? That's the first one. It's just something that should be very simple. I'd be surprised if it wasn't, but it just came up in my head. So I'm curious. So sometimes most obvious things aren't really brought up. The second thing is in regards to child safety. So I've been working a lot on stuff regarding like ball drops and like the drug issue in Portland, particularly East Portland. And so I wanted to know what what safety measures are in place to ensure that foster youth, are not interacting with like unsafe environments, or what tools, et cetera, et cetera. That one is one that sort of relates to the work I said I was doing. The third is that when I was in the foster care system, which was less than a foster care system, which was about 5-6 years ago in the child foster care system, there of course were some opportunities for like upwards mobility and stuff like that, job training, but I feel like there's not enough, not just coordination, but communication about opportunities. So I wanted to see if that is like a funding issue, if there's something legislatively that can be done, or if that's purely a policy and coordination collaboration issue. For example, I've been confirmed to the Autism Society of Oregon board, executive board, this fall. So I want to ask if there's something that we can do there. And then the last question is what should be really low hanging fruit. So I went to like a sex trafficking sort of thing a couple months back. And one thing they said that has, a few months back, that stuck in my head, of course, was the lack of funding at the state level for tackling that, not just that sort of abuse, but also like that sort of the sort of communications, that content and stuff like that. Like I heard there was only like 2 people in the entire state who are tasked with that sort of thing. And so I was wondering if that's something that like would have to be written into law to get a little bit more funding for and stuff like that. So yeah, those are my main questions. So, and ideas. Sorry.
If we can't answer those questions right now, Dean, since those are pretty far-ranging questions, if we can't get to them right now with the people on the line, we can certainly make that an agenda topic in the future as well.
Yeah, no problem, no problem. You don't have to answer, anyone that's too long for here. So,
I would say so of the 4 subjects, gosh, I think there are probably different people within ODHS that could talk about each one. So, in terms of like the religious rights or considerations for kids in foster care, I think that could be its own kind of presentation and topic. Safety in regards to substance abuse can definitely be its own topic. That's a huge one. Opportunities for older foster youth, it sounded like you were talking about, or opportunities for foster youth. We could definitely have our transitions team come and provide information on that. And then sex trafficking, I saw Lisa Bender pop on. I don't know if she's still here, but there are some reports on kind of and audits, I believe, that like kind of recommendations on what the state could do around sexual exploitation and sex trafficking, and DHS Child Welfare has talked about some work that we do for identifying children at risk of that in our system and improving some of that. So I think, Casey, each one of those could probably be its own independent conversation, and I'll leave it up to you all. But those would be different people, Dean, that would probably need to come and talk. And I don't want to put Donna and Billy and Sarah on the spot to talk about the religious compliance stuff, but maybe coming back.
Yeah.
And because I have one more agenda item. I don't know if we.
No problem.
Michelle.
We're thinking that would be quick.
Hey, Michelle, Casey, I just got an email from Rachel that something came up, Rachel Kearns Henry from the governor's office, and she is not able to attend today. Lisa has come on, and Michelle, I don't know your schedule. Could we hop to Lisa and then come back to talk about the phone?
Sure. Yeah, I can wait.
Okay. Thank you. I appreciate that. Sorry,
Okay.
Casey.
Well, we're gonna.
Just wanted to let you know.
No, you're good. we're going to transition to Lisa Bender, and she's the CW Assistant Deputy Director. She's going to, and Donna, I'm sorry, I am terrible with just, CFSR and PIP. I'm not sure what that stands for. Oh, I think we have it there. So, Lisa Bender.
Thanks, Casey. Lisa Bender, she, her pronouns, Assistant Deputy in Child Welfare. And I am going to talk about the Child and Family Services Review, which is what CFSR is. And I did just use an acronym on this slide, the PIP, as we like to call it, the Program Improvement Plan that comes along with that PIP. So this is what I'm going to go over today. I'm going to talk to all of you about a little bit about what is the CFSR, what is the Child and Family Services Review, how Oregon has fared so far in this round that we are in now. And I'm going to talk a little bit about the program improvement plan options that have been laid out for us. So starting with what is the CFSR, or the Child and Family Service Review, it was established in 1994 when there were some amendments to the Social Security Act. So for many of you who have worked in or around child welfare, you may know that both Title 4B and 4E of the Social Security Act have federal funding that supports state child welfare programs. 4B is some of the more preventative stuff, supporting like family preservation and family support and that sort of thing. And then 4E obviously is the drawdown of federal dollars when children are placed in substitute care. So the whole point of this was really to have some federal oversight over states' compliance with these things as they roll out their child welfare jurisdictional approach. And so the cadence of the CFSR is done in rounds. So like I said, it passed in 94, but it took probably about 6 years or so before they got that fully implemented, writing rules, procedures, having a process for how they were going to review all the states and jurisdictions. And so it wasn't until about 2000, I believe, that the very first CFSR review happened in the US. And so it's done in rounds. It's intended to be done every 4 years, every 5 years, roughly. You'll notice that we are quite a ways out from round 3. So the way they have to do these, because there's 50 states and only so much bandwidth in terms of the ability for the federal government to do 50 reviews, the states are done in cohorts. And so there'll be a handful of states that go year 1, a handful that go year 2, year 3, and year 4. And you will notice that Oregon went through the round 3 of the CFSR and got our final report in March of 2016. You'll notice there's a big gap there. I mean, I think we all know that the calendar years of 2020, 2021, and beyond were a little different than most years, going through that global pandemic and really delaying for a while the start of round 4 for the CFSR review. However, we have started it. I want to say it started technically like in around 2022. And we were one of the states identified in year 2 of that. And so we are smack in the middle of the CFSR round 4 for the Children's Bureau. And we just received our final report actually last month. So to date, I do remind people that sometimes the headliner on these reports are no state passed or Oregon failed or no state has ever passed. Every state has been found to be not in substantial conformity with all of the outcome measures or systemic factors during these reviews. And I'm going to explain a little bit about why that is, because to pass, it's like a 90 or 95% bar on some of these, particularly with case reviews. And so states will pass some things and not others, but no state has ever even come close to passing the entire Child and Family Service Review. Which is going to lead into some of the conversation about this new option on the table for a program improvement plan. So the CFSR is made up of outcome areas, systemic factors, and case reviews. And so there's 3 core outcomes. I'm sure you all hear about it: safety, permanency, well-being, safety, permanency, well-being. Within those 3 sort of broad outcomes, there are actually 7 specific outcomes tied to 18 very specific items that are that are scored through a qualitative case review process. So we do a sampling of cases. We have reviewers who are trained to go in and look at a case, review it from start to finish, interview caseworkers, interview families, interview people who have information about the case, and say, did this case meet all of these requirements and expectations to be considered a strength in this particular item? And then, in addition to the very sort of narrow specific case practice, there are these other 7 items that are called systemic factors. And that is really about how the system is functioning as a whole. You'll notice actually on this slide and on this slide, there's some little stars here. And I'm going to talk about those because those are areas where we did pass some of our items. You'll notice there are the 7 systemic factors. We actually passed 3 of those areas and passed some components of another area. And so the first area is the statewide data information system. So like the system we use to track all of our information in child welfare, information system, IT system. The case review system as a whole, that is where we are talking about not just DHS as the child welfare agency, but also the juvenile court process and dependency courts and how cases are moved through those court systems and getting kids to permanency. The quality assurance system, which is how states are doing and building a system to constantly review their work and do CQI. And when I say CQI, I mean continuous quality improvement. The staff and provider training. So how well is the agency doing training both their internal staff as well as providers, resource parents, other individuals who support this work. The next 2 items, service array and resource development, really are how are we getting the services that children and families need externally in communities. Like what does our system and service array look like? Do we have the appropriate placement types for kids? The next 2 items are agency responsiveness to community. So how are we engaging community and partners in our processes and in reviewing our work? And then the last 4 items are all related to foster and adoptive parent licensing, recruitment, and retention. So those are the outcome areas, the systemic factors, and then there's one more piece. So the CFSR involves doing a assessment, submitting it to the federal government, saying, here's how we think we did. They review that. They also do some interviews with partners. And then they look at a couple of pieces of information. They look at all of that in addition to what we call our statewide data indicators, so administrative data. So all of our data goes into these systems, right? Because we're reporting back to the federal government. And so those are like admin aggregate data points as opposed to the case review, which are a sampling of very specific cases, and you're going in and looking at each case and qualitatively saying, did it meet this? So there's kind of a couple different ways in which data is gathered. So I'm going to talk about the results now. Before I talk about them, I'm going to do just a quick disclaimer because I'm going to talk about Oregon and how Oregon did compared to Oregon's last round, official round of CFSR. But then I'm also going to talk a little bit about how Oregon is doing so far compared to other states and jurisdictions who've also gone through round 4. The challenge with that is not every state has gone yet. So as I noted, we are smack in the middle. We had year 1 and year 2. Oregon was the last year 2 state to get their report. And then the other half of the states should be issued reports in the coming 2 years. However, a sample size of 50% is actually really good. We don't even come anywhere near that when we're sampling our CFSR cases for review. So if you're curious who's gone so far, the states shaded darker and Puerto Rico have all had their reviews done. The lighter shaded states are still going through the process and should be getting their review this year or the following year. I show this map only to show that there is representation literally from all over the country. So it's not like they go in regions and, only folks in this area go first. It really is spread out. So we feel pretty confident that the sample that we have of performance isn't going to dramatically change as more states get added in terms of their results. So how we did from round 3 to round 4 of those 18 case review items, and I'm going to talk about results in a couple buckets, the case review items, the systemic factors, and then those data indicators. And on the case review items, we improved on 13 of 18 items. So of all of those 18 items, on 13 of them, or over 70%, about 72%, we saw improvement in our scores from 2016 to, I say 2025 because our report was done. We just didn't get it until 26. In addition, we actually did get 2 strengths, and one of those was placement with siblings. At about 95% of cases reviewed, had that listed as a strength, and placement with relatives, where more than 91% of cases reviewed listed that placement with relatives was a strength. In comparing, so that's comparing sort of Oregon to Oregon over time, but then in looking at Oregon compared to other states, those, other 25 jurisdictions that have had their reports issued as well, Oregon is either at or above average on 15 of those 18 items. So 83% of the items, Oregon is doing just as well, if not better, than other states are doing on average. I know 2 strengths doesn't sound like a lot out of 18 items, right? It just sounds like a very small number. For perspective, though, to date, the average state has passed with less than 1 case review strength. Just barely. It's 0.96, but still, so you could kind of say Oregon has twice as many strengths so far as the average with just those 2, because so few pass, given that 90 or 95% needed for it to be considered a strength. In addition, even in some of those areas where we didn't pass, we are showing some significantly better performance than the national average on some items. 2 examples of that. Item 2, efforts to provide services to the family to prevent children's entry into foster care or reentry after reunification. So essentially, how well are we working in homes with families to prevent children from either ever experiencing foster care or going back? Oregon scored our case review score showed about an 84% strength on those cases. 84% of cases reviewed showed that as a strength. And like I said, you need that 90 to pass, but I think the bigger interesting comparative point here is that the average state in year 1 and year 2 so far has only scored about 60%. So it's almost a 24% difference between where the average state is performing on that as opposed to where Oregon is performing on that. The other item that, again, big difference between Oregon's performance when you look at other states is the frequency and quality of visits between caseworkers and the mothers and fathers of the children in care. Oregon scored 62.2% as a strength. Again, 60%, 62% doesn't sound great, but when you look at how all the other states are doing, they are on average just around 42%. So again, you're looking at like a 20 percentage point difference between how the average state is performing and how Oregon performed. So that was the case review items. And we have information on every one of those 18 items for anyone who wants additional information. But I'm going to move on to the systemic factors. So as I said, there are also 18 systemic factors. There's 7 core systemic factors, 18 items underneath that. So each systemic factor might have between 1 and 4 items, sub-items underneath that. So we went from, again, comparing Oregon to Oregon, we went from round 3 having 5 systemic factor item strengths to in round 4 having 9. So not quite doubled, but close. And then again, in sort of comparing where Oregon is at with how other states that have gone so far this round, the average state is getting between 5 and 6, roughly 5.5 exactly. So somewhere between 5 and 6 is how many systemic factor strengths states are passing, whereas Oregon has passed 9. So again, pretty significant results compared to where the average state is performing right now.
Quick question, by the way. Did the from the last time, last round, 2016, did the other state systemic factor performances decrease or increase? Because it might be interesting if we were the only state to actually increase, or one of the few states to actually increase in our performance in those factors rather than decrease, like I'd expect most states to.
Actually, I actually have all of that. And I could talk ad nauseum about this, but I won't bore all of you with it. But actually, all states are doing better on systemic factors, somewhat. Um, like I said, showing so far that states, I don't know what the average was for round three. I could figure it out probably in, 2 minutes because I have all of this at my fingertips. But in terms of how they did in round three and to this round, but Oregon definitely has improved in our own performance, and we are also still doing better than I think other states were. Now I'm really curious, and I think after I stop presenting, I am going to go find out what the average systemic factor score was for round three for all states, because I'm really curious. But I have seen where everybody's doing some increase, but I'm seeing Oregon's increase again still as out performing sort of what the average state is doing. Now let's talk about the data, the aggregate big pool of data. I always go like this is like the case reviews are kind of the subset. You're taking a little piece of the pie and diving deep, whereas the data indicators are all the administrative data of all the children who touch our system. And there are 7 of those items. I don't know why feds really liked 7. There were 7 outcomes, 7 systemic factors, and 7 data indicators. So I guess 7 is the lucky number, 777. Of those 7 items, there are 3 where we are exceeding. Those are all of our permanency measures. So permanency within 12 months for those kids that enter care and within their first year, for kids between 1 and 2 years, and for kids that have been in care for 2 or more years. All of those are exceeding national standards. So we are doing better than the majority of states. Re-entry into foster care is no different. If you compared it to it's statistically no different to every other state in terms of re-entry. There are 3 areas that we are not doing better than other states. And so I want to talk about those. One is maltreatment in care. Another is the recurrence of maltreatment within 12 months. And the last one is placement stability. The first 2 are unique. And I'm going to actually go into the next slide and kind of talk a little bit about what makes them pretty unique. The placement stability, we've seen some improvements in placement stability. Every state has struggled with that. Actually, I think you all are fully aware of some of the youth mental health crisis that we're experiencing. All states are seeing more of that placement stability increase. In fact, every round of the CFSR, they set a new national standard based on how all states are doing, and they actually changed the standard around placement stability because every state is seeing more instability. So, but foster care, maltreatment and foster care and recurrence of maltreatment, of course, we absolutely want to see improvements, no doubt. One of the unique things about these 2 data points is that there are a lot of things in Oregon that we call child abuse that other states do not call child abuse. So some of the things that are coming up when kids are in care that are getting lumped into the maltreatment and foster care aren't exactly what was sort of intended by those. So for example, I'm going to go on to the next slide because I think it'll make it a little more apparent. So we took all of our cases that showed up as maltreatment in childcare. So kids that are in an episode of foster care and they experience an incident of abuse. We did a deep dive with our continuous quality improvement team and looked at what the reasons were, because there isn't like a checkbox always to explain exactly what the situation was. Sometimes you got to dig into the actual case and read the notes and really understand what the scenario was. What we found was that almost half of our cases were either third party, meaning no familial relationship. And this is something unique to Oregon. Oregon is the only state or jurisdiction that defines child abuse in the context of anyone. We assess anyone who harms a child for child abuse. Every other state follows the federal U.S. code kind of definition that is laid out about, child abuse laws being relevant to caregivers or persons responsible for the care of a child. So that would be parents, guardians. In some states that extends to coaches or teachers or someone who's in this role of being responsible to care for a child. Whereas any other act that a stranger on the street, were to harm a child, that would be solely handled by law enforcement in other states, completely via criminal code. It would not come into your civil child abuse statutes. However, Oregon is the only state that does not define who those laws apply to, so therefore it applies to everyone. So these are cases that, again, not to say we don't want to see bad things. I mean, we absolutely don't want to see bad things happen to kids, of course. The challenge with third parties is that we don't really have jurisdiction to do much if we do, in fact, substantiate abuse. So if, for example, a stranger abuses a child, we can't go petition the juvenile court to intervene on behalf of that child because their parents are safe. So it kind of inflates those numbers around like maltreatment and care because we're including things that other states don't. Another big, huge chunk was historical abuse. This was in many ways a data entry error that we are working to get corrected. So when you call into the hotline, you have a report date, the date it got called in. However, the incident could have been something that happened 6 months or a year ago or 2 years ago. Our screeners at the hotline are trying to get information about exactly when that occurred so that they can take into consideration and document an incident date so that it doesn't appear as though the abuse is happening while this child is in foster care or that it's happening in foster care. What we found is that oftentimes callers don't know that. If you're calling into the hotline and as a teacher and a child talks about abuse that happened and it was warm, so maybe it was summer, but they don't know when. So we weren't doing a really good job of catching those incident dates. So we've been doing some different things in terms of just even within our system to try to get better data entry so that our child protective caseworkers or our CPS workers, after they're doing an assessment, they are getting prompted to update that information and make sure they're putting in an incident date. I'm sure you all know when kids come into foster care, they may start feeling safe and start disclosing things that happened previous. What we don't want is for it to look like that abuse occurred while they were in care. So you'll notice in this pie chart, only about 11% of all of our maltreatment and care, all of the cases that end up in that are actually resource parents. So I always want people to kind of put that perspective on things that, this maltreatment and care really was intended to help states measure whether or not the places we're putting children in when we remove them from their families are safe. And Oregon's capturing a whole lot of stuff in there. The biggest area is actually during trial home visit, right? And that is when parents, re-abuse occurs. That as long as we have the case still open, those kids are still considered in an episode of foster care. So we consider that maltreatment and care, even though it's not really the substitute caregiver necessarily that we are assessing. I don't know if that made sense, but I just wanted to I always tell people really dig into that because our maltreatment care numbers do not look great, but until or unless we actually define abuse in a way that other states do, it's never going to look the same as other states. It's like comparing apples and oranges. Last, I will get through, and I see there's some things in the chat, but I don't even know where my chat is. So I'm hoping I can get through these last few slides and then I can answer any questions. So after we do this review, every state gets to put together a program improvement plan to say, yes, we're not in substantial conformity. And so we're going to come up with a plan for how we're going to improve. And this is the typical CFSR process up until now. Put all this evidence on the table. We submit this assessment and say how we think we did. They do the on-site review. They interview partners. We have the case review. And then they issue this final report. Like I said, we got ours last month. And then we develop this program improvement plan, which is also now, we take this evidence. It's usually updated because it's been 2-year process or so and say, this is how we want to move forward. And so we are here. And we have 90 days from the date that we get that final results letter, which was March 12th, to submit our program improvement plan. Now, a lot has changed over the last 6-ish, 12 months. So this was the process we were in. We had our statewide assessment submission back in August of 24. We did those case reviews and those partner interviews that winter and into early 25. And then we kind of kept waiting. There was an election, there was a change in administration. Anytime that happens, that changeover in administration often comes with changes in high-level staff and leadership at different agencies at the federal level. And so we kind of kept waiting and waiting and thinking like, are we going to get our results letter? We were actually expecting it last summer, and it just came, as I said, last month. And that is in part because there were a few things that were announced over the last 6 months. So in November, there was an executive order called Fostering the Future for American Children and Families, which really proposed some changes in the federal approach to child welfare. And then, short order after, there was a release of a new technical bulletin or guidance from the Administration on Children and Families. That should be ACF, not AC. And it offered what they're calling a pilot program improvement plan called A Home for Every Child. And some of you may be more aware of this than others, but that is sort of this pilot. And then you'll see, again, we just got our letter. And so I'm going to talk really quickly just about those two options. They gave every state an option. And one was you stay with this traditional PIP. You keep doing all these case reviews. You have a formal measurement plan. You have quarterly reporting. And there are financial penalties associated with not meeting your measures. Or you choose this pilot PIP, where the case review portion is now completely optional. We don't necessarily have to do those in-depth qualitative reviews. There is one primary measure, and that is a ratio of children in care to homes available being 1-to-1. There is monthly reporting, and they have said financial penalties are only applicable if you don't implement the strategies you agreed to in your program improvement plan, or if you don't report your data, but that they would not be tied to actually meeting a quantitative measure of like an increase in 2%. So there is some significant benefit to states to choose this pilot option, because I will just tell you, our last PIP was 33 pages long. It took 9 different submissions or resubmissions and 18 months of negotiation with the federal government. So that alone, you imagine the administrative burden that goes into that. And it had like 67 different measures in it, to something that is much more streamlined, focused on, a home to child ratio, as well as some very specific lead measures. And so we did just this week actually formally notify the Children's Bureau that we were going to take that pilot, the Home for Every Child. I wanted to give people just an idea of like where we're at right now, where Oregon's at. This is old data. It's probably not exactly accurate. It was actually the end of 2025 when I pulled this, so back in December. And I looked just at how many children were in care or observed in care on that date, 4,500-ish. How many homes were certified, how many child specific, as well as general app. And at that point in time, our ratio was around 1-to-58. I've seen it actually listed in other places in the 60s, 1 to 0.6, 6.5. I will also say this example doesn't take into consideration our Proctor Foster, so the Foster Plus or those BRS home-like settings. We've also heard that perhaps some of our IDD homes could be included in that, particularly when those IDD homes are serving a child welfare child in them. So there are some other factors that might make that. We're looking probably, like I said, around a 0.7 to 1, 0.65 to 0.7 to 1 ratio currently. However, what we don't want is the message to simply become, we want to, have a bigger foster care system. We want more foster homes. We want to, increase the number of kids, and we absolutely don't want that to be the message. So what we've really focused on so far in that draft of our program improvement plan have been 3 main goals. One is staying true to our vision for transformation and continuing to focus on prevention and early intervention when possible. So one of the ways to reduce that ratio is to have fewer kids in foster care. It's not just about increasing the number of homes, it's also about decreasing the number of children needing foster care. That's how you can get to that 1-to-1 ratio. So how do we prevent unnecessary removal? And how do we do that through like high quality screening and managing child safety in home whenever we can? we have a fundamental belief that a home for every child begins first and foremost with the home that they belong to when we intervene. The home, the family, the community that they belong to. When we cannot safely keep them at home, how do we keep them connected to family and kin with relative placements, keeping them close to home when relative isn't available, but how do we keep them in their community? Then also looking overall at the capacity and retention. So how are we doing more targeted recruitment? If you go back to this slide, you can see like our teen population is very high. When you look at, I know these age groups are not distinct, so some of them are like 2 years or 3 years. But if you look at that 13 to 17, like there's definitely a need for foster care for those older youth, and sometimes we struggle with finding homes that are willing to support those older youth. And with that, I threw just a whole bunch of information at you. And so I'm going to stop sharing now and take a look at the chat and also open it up for any questions. Oh, it looks like the things in the chat were for you, Michelle.
Lisa, I've got a question for you. So I heard you talking about a little bit about the financial penalties, but we're doing really well on some metrics. Is there any carrots, any funding bonuses, for example, for hitting your benchmarks, or is it only you don't hit, you don't get funding? My second question is more general, which I really appreciate you coming today. I think that, part of our statute of this commission is checking on these federal standards. When I first came onto the commission 5 years ago, I was really skeptical of the standards because as a juvenile attorney, I'm of the mindset of, if it takes 18 months for reunification, that's much better than, establishing a guardianship at 12 months. What I've learned over the last 5 years is that, it's not one size fits all. It's hard to say that, for a 10-year-old, they need permanency now, and we can always find a psychologist on both sides to do that. I guess my question is here in Oregon, do we agree with these federal standards, or do we on occasion think, no, it makes sense for, permanency in 24 months? And I know we do because we see it on a case-by-case example. I guess what I'm really going for is, do we actually even know that is a good federal standard? I mean, I know that we're able to say that on a case-by-case basis, it might be better and they need permanency now, but have we ever, been able to go to kids that are 18 and older and say, what was your experience? And if you would have had to wait another year, would have you? And so that's my concern is I'm always in favor of reunification if we can do it safely, regardless of the amount of time it takes. And, I know we have a lot of psychologists on both sides that'll support whatever position we want to take on that. But just as a big picture in general, I feel tying things to federal standards forces our hand sometimes when we're not doing what's best for the kid.
Yeah. I love this conversation, Casey. Thank you for both of those points. One, in terms of carrots, we don't know. There's no explicitly, I mean, there isn't anything tied specifically to the PIP. There has been talk though about some discretionary grant funding potentially that states could apply for, and that there may be some priority emphasis for those states that chose this sort of pilot. I haven't seen anything in writing though, so I really don't want to say that is for sure a fact. But typically, no, there isn't. It hasn't been you get a bonus if you meet it. It's been more of the penalties. We're going to withhold funding. That has been the way the CFSR has historically run. So that was your first question. Your second one in terms of permanency. I mean, a lot of this comes from, this federal law, the Adoption Safe Families, there has been a push for permanency. And so without significant changes, I think to federal law, there's going to be this push for permanency. However, I always remind people the national standard is 40% of cases being there, right? So we know that we're not going to, it's not an unrealistic 80%, should be getting home within 12 months, but it is making sure that kids are not spending far more time than they want to. So I think there is room for that give and take in some situations. But I mean, I will say as somebody, I remember when that law first passed around, the timelines and a lot of people who have worked with families and parents who have substance use disorder know that it can take multiple attempts, and 12 months is a really short amount of time to see the change needed. So, I mean, obviously, it's a balance. We want, kids to have permanency as soon as possible, and we also understand that permanency for the sake of just saying like, yep, permanent now isn't always the best case either. I mean, I think that's why we really look at those sort of averages and how are we doing on this measure as opposed to saying everybody needs to meet this measure, if that's helpful.
Yeah, just as a comment to that, as a bigger picture, the one I see that most often with is that we have, a mental health allegation, and what I've learned is that it takes a while for people to be ready for DBT therapy. And so oftentimes what we get is, they do the psychological evaluation. We don't get the results back until 6 months into the case. It's recommended that they engage in some, mental health, some med management, and then eventually DBT. Well, we hit the permanency hearing at a year, and they've just started DBT, and the agency's always asking to change the plan with the explanation of, well, permanency or DBT, really takes a year, and the child can't wait that long. And so many of these mental health ones were pushing to change the plan when I'm like, they're following, their medical providers' guidelines and recommendations. They can't do DBT on day one. And so I see that so often, and it's frustrating, I think, as a parent's attorney.
Yeah. And that may be a good conversation for a future meeting with the permanency folks. I'll admit that is not my area of expertise. Permanency, I have always been more on either the preventative or early upfront, early intervention, CPS side of things. So happy to have somebody else kind of come and talk more about that, but I hear you.
Okay, so looking and thinking about that data, I have two main observations / points / questions. They're not sort of like in any specific box, so that's why they're, sort of each of those. So the first one is I'm thinking that the placement of the child can have a significant, what do you call it? Significant impact on the mental health outcome and the abuse outcome. And let me explain what I mean by that. By placement, I'm not just saying like putting them in a home. I'm talking about location, access to, services, parks, but not just parks, entertainment, all that. Because when people are alone, they are more vulnerable. It's just a fact. When they have less people and less, social relationships and less things to do. So that's something that I don't know, maybe could be looked at. It probably already is factored in, but definitely greater, I think a greater focus on that for the sake of the youth is needed. And the second, of course, is also related to that, and that is the fact that I think a big reason we're seeing these mental health crises and a lot of abuse in general is, of course, the mental health crisis. And what that really boils down to is, I mean, yes, there are adults and stuff like that, and people, bad actors. There always are going to be, but I think it's elevated a particular point because I don't think we are healthy as a society in general. Like that shouldn't be a surprise for anyone. Not just consumerism, but all sorts of things. And so making sure that they are able to find close bonds and stuff like that. Like this is something I have personal experience with. So this is something that I think would be very helpful. That's I know it sort of ties back into the first point, but I really just want to drive that home. And of course, the question is how, of course, et cetera, et cetera. And then not really like a separate observation, but a big thing regarding this has to do with the access to mental health care, of course, and all of that we lack. And just the fact that a lot of caseworkers, from my experience, remember I've been in foster care within the past decade. They are they're probably stretched thin, yes, but they also do not share enough opportunities with the youth in general. And so this leaves them quite a lot, so this leaves them quite vulnerable. So as I said, communicating opportunities, and making sure that we are working hand in hand with organizations on all these issues will probably be like one of the big ways that we can probably help reach those goals in the PIP. And then just a minor criticism, I'm also conscious about going to the federal standards, much like Casey addressed, simply because I worry that it could oversimplify things instead of the child's and youth's holistic well-being. So, yeah.
You touched on so many things that I appreciate and value and would love to talk about more, particularly the sense of belonging, right? I mean, we know that children do better when they belong to a family and to the people who love and care about them, which is, I think, been our emphasis in really trying to, when we can, support children to stay with their families. When we can't, are there other relatives or people that child knows that we can keep them with? And then if we can't do that, are we keeping them in their community? Are they still attached to the same school? You mentioned parks, like community groups. Who's that child's I know some people have a negative connotation, but I don't when I say who is that child's tribe? Who are their people? Who are the people that wrap around them? And so definitely agree 100%. And yeah.
Yeah, and that's particularly fascinating because in my specific case, we actually had my social worker for several months actually transport me to Robert Gray Middle School because I went from West Portland to East Portland. So I don't know if you know anything about my particular case when I was in there, but yeah, so.
Yeah. No, I appreciate all that. And I think that has been sort of the direction that we are trying to go for sure. And yeah, I hear you too in terms of the federal measures, which is why there's always been that case review to balance some of the administrative data, right? There's all this administrative data, and you could look at, all kinds of numbers and how long a child stayed in care and how many placements they had and all of those things. But then there was also that qualitative case review to really dig in and look at that, which is why Oregon, even if we are not under a PIP requiring us to still do that qualitative case review, we're going to still do it because that is an opportunity to drive in and hear more of the story underneath the data that you don't always get from just administrative data. So I appreciate both of those points.
Well, thank you for being here, Lisa. It's really great to get those updates. I think, we hadn't got a federal update on where we were for a while, so appreciate you coming. Sounds like things are going really well in hitting those benchmarks, so thank you. Michelle, if you're still on the line, we'll transition back to you for our last topic, which was, I believe, the phone initiative.
Yeah, and I'll keep it a bit short because I know that we're kind of running out of time here before 1 o'clock. So this is really just a preview of a kind of a conversation that's been happening within child welfare that I just wanted to loop you all in on. So I have been in conversations with the foster care ombudsman, Alexis, and now with Ellen Bell, around the Foster Care Bill of Rights. And if you all know, it was just updated this last short session and has key language around having unmonitored access to attorneys, to the foster care ombudsman, to the CASA, and trying to think about how does that play out practically in a child's life, right? So if you know now, I think probably I'll just ask, do any of you have a landline today? No, right? Like this is a different world. So kids today are often needing to ask their resource parent or whomever they're with to use their phone if they wanted to contact maybe their CASA or their attorney or their caseworker. And I will tell you, like in my life, it is a challenge. It would be a challenge for me to hand my totally unrestricted cell phone that has all access to everything in the world to hand that to a child and say, yep, I'm gonna walk outside, you call your attorney and, let me know when you're done. I like it is just it's a friction point that we hear from foster parents that they have in trying to balance how do they provide, safety around the use of maybe an adult cell phone with the needs of the child to have this unmonitored access. So we've been talking about what are some solutions to that? What are some creative options that we could explore that could live into that foster care Bill of Rights, and also ensure kids have safety around their use of communication devices. So we've been in some conversations with a couple of different companies over the past month or so. One is called Tin Can, which is a Seattle-based company, and they have what are essentially kind of landline phones with a Wi-Fi connection that are designed for children. They have speed dial features to be able to, you push a button and it will automatically call maybe a grandparent or whomever the administrator is set up. For that, it can only receive calls from pre-approved numbers, and it can only make calls out to pre-approved numbers. You can set time limits on when somebody could receive or send calls. And so we've been talking about how this could be a potential pilot for our kids, probably between 6 and probably like up through the age of 12 or 13, to have an option to have a device in their home in which they could have presets for the foster care ombudsman, for their attorney, for their if CASA, if they have one, their caseworker, and then have some communication on the side about kind of who to call and kind of what scenario if you're trying to ask a question or trying to get a hold of somebody kind of who is the right person. But it would be a way for kids to have that unmonitored, unregulated access to those people. We are definitely in the very beginning conversations of what that could look like as a pilot and try out and do kind of some studies and surveys about if that is a effective solution for our kids. For our older youth, I think many people have heard of Bark phones. They are specifically like I just saw one this last weekend of my cousin's daughter. It looks like a regular Samsung smartphone, but the base software to it is not the Samsung software. It is Bark software, which has kind of built-in parental controls that can't be worked around. And it has a scale of different levels of access. You could restrict it to have high restrictions that they can only call and receive calls from certain people, to the spectrum of having basically access to a full smartphone if there are no safety concerns with that. So trying to think about, the agency is currently paying for and subsidizing phones for our kids in care, but really the struggle is with foster parents and caseworkers having to have those conversations on parental controls and trying to make sure that that is a safe use of that device. And I wish Adam was still on this call. Gobi actually started using Bark phones in their therapeutic foster homes, and they have found it to be incredibly successful for both the kids and the foster parents in terms of having safe access to phones, and for there to be just a little bit more regulation, especially when there were concerns about sexual exploitation or past sex trafficking concerns. So I just wanted to update this group so that you were all aware that this is a conversation that's happening, like at the very onset of this concept. And I know that Alexis previewed this with our Youth Advisory Council last month, or maybe it was still this month. I can't remember what date that was. And they are very excited about it. They're very interested in being part of the policy writing if this pilot were to be something that gets off the ground. And I just wanted to make sure you all were aware of the start of this conversation, to loop you in if there's anybody that has particular interest in being kept up to date on this kind of initiative.
Thank you, Michelle. My comments to that is, I think that's a great idea. I have never had an issue having like private conversations with my kids. When I see them, if they're old enough, I generally take them out of the house. or go for a walk or something. So I've never had a problem having that privacy when I see him. And I know as an attorney, I've got to see him every 90 days. I think COS says, and caseworkers see him once a month. But on the flip side, I very, very rarely receive calls from my clients. And so, that could be something that prompts more future contact, especially since discovery comes to me about 2 months after the fact, and so when I see incidents, it's like so long ago. I think it's a good idea. I would caution that, I don't know if it needs to be one size fits all. Certainly I heard you say kids in, higher levels of care or kids we have concerns about, but I don't know if that's everybody needs the parental controls. I think some people are a little bit more responsible, but it's probably easier to roll it out as one package, so I understand that. But I think it's a great idea, especially for kids to have contacts with their siblings. That's what I hear the biggest complaint about, is that the only way they're able to have contact is when they're visiting another parent who has the kids with them. And sometimes they just want that contact with the kids. And if they're able to make phone calls, I think that does a lot to help keep that, as we were talking about, that village in place.
Yeah. Yeah, I forgot to mention that point. Like, this could definitely be ability to have kind of unregulated contact with relatives, right? Again, if you're having to be contingent on when your foster parent or resource parent or relative can hand you their phone to be able to call somebody, it's a barrier. And I think if we can remove barriers where they can just pick up their own phone and make those calls, or text if they have the Bark phone, like, we would just love to know, what does this mean for sibling contact, for relative contact, for their ability to communicate with attorneys, with their CASAs, with their caseworkers? Because you're right. Like, I think what we hear now is that caseworkers are saying, like, I don't really get calls, or, like, for especially our younger kids, they're not getting contact. The kids are beholden to whenever the adult makes time to come see them. But I know for the foster care ombudsman, they rarely get calls directly from youth. And that's one of the things that we've really tried to figure out, is like, well, what are the barriers for kids to be able to make those calls, to say, this just happened, I want you to give me a call back, right? Because it's not going to be something that's going to be 24/7. But I think right now the idea is to do a pilot, and it would be probably a regional pilot in Oregon. I think there are some good reasons for it to be in rural Oregon, not only because of the numbers, but because those kids often are more isolated, just because of the geography and locations, where you may be a mile out from a business or someplace that you could make a call if you wanted to. And so trying that out, seeing how it goes, getting survey results before we think about if it would become a statewide type of program. I think one clarification, Casey, I think for the Bark phones, I think it would really be up to the caseworker on, like, what level of restriction or no restriction that a kid may need, and whether they even need a Bark phone, right? Like, maybe they are 17 and totally able to function and have a totally independent smartphone. There would be ability for flexibility in that. But for our younger kids, we do understand the research is really saying, for our 13, 14, 15-year-olds, like, having some monitoring and assurance of kind of what access they're having, especially with, like, social media or on the internet. Like, how do we have some kind of parameters or understanding when there are concerns about safety around that. So lots of, I think, probably more policy that needs to be written around how the Bark phones would work. I think the landline one is pretty, like, basic and simple, and probably the easiest to roll out. And I think our idea is that there would be one in every foster home that has a child between the age of 6 and 12 or 13, kind of maybe depending on development. And just see how it goes, how often it's used, how foster parents feel about it, how kids feel about it. Right now, this would be philanthropic funded. We don't have a budget for this. And so there's a lot of kind of steps in looking at what this would look like. But again, just don't want to be moving towards an idea or concept without letting you all know and looping you in very early on this. So this may go nowhere, it may go somewhere. I just would like to keep you up to date as it moves. So thank you for the time today.
Thank you, Michelle. With that, we'll go ahead and open it up for public comment. If anybody has any comments. I think we've only got a couple of members of the public on today, but if you'd like to make a comment, now's your chance. Okay, then we'll close public comment, and it looks like we're done with the agenda 2 minutes early. So we'll officially call this meeting at 12:58. And just a reminder, we'll have our meeting next month, third Wednesday. I don't have my calendar open, it's on my phone. So third Monday, same time. We'll see everybody next month.
Hey, 1 second, really quick.
Yeah.
I just wanted to add that we're switching over from Zoom to Teams. It shouldn't really change anything for anybody. It'll just be a different link to log into. But what will happen is the current appointments will be deleted basically, and you'll get new appointments. Sarah will be doing that. Before the next meeting. We just don't have Zoom licenses anymore. So with Ellen departing, we gotta switch to Teams. But everything else should be the same. It can be recorded, transcribed, all of that. But so that's why you'll get a new appointment with a different link. Sorry to jump in. Thanks.
But
Perfect.
by the
Thank
way,
you.
by the way, Casey, I actually since I did tell you guys last month I was going to start reaching out to you guys. Can you actually email me? Do you have my email? Email me your number as well as yours as well, Donna, if that's all right, and Jesse.
Yeah, what I think we need to do, Dean, is probably put together a contact list for our commission, because we have all of each other's emails, but I don't think we have a phone list. So potentially we can do that and get it out to everybody.
Yeah, and for some reason, writing email just feels so exhausting. I don't know why. So, all right. Thank you.
Okay. All right. Thank you, everybody. Have a good rest of your day.